A Wisconsin child has died of suspected hepatitis, with now 6 states investigating the illness sweeping the world. This comes as hepatitis cases continue growing after 20 cases found in the U.S., 200 cases globally, with at least 18 kids needing liver transplants. Joining us now to discuss these rise in cases is internist at Northwell Health, Dr. Frank Contessessa. Dr. Contessessa, give me your feel for how dangerous this could be. We know these are small numbers, but what indicates to you that this could actually be a threat to the average person here?
Sure, and thanks for having me, Bob. You know, there are some concerning things going on here. The fact that this is usually a fairly mild virus that seems to be causing these cases. It's called an adenovirus. This is a very common virus that we see in the environment. It often causes mild upper respiratory infections like the common cold. It can cause routine pink eye, the viral pink eye that we typically see, very easy to spread but causes really no harm, just a mild case of pink eye. Can cause gastrointestinal, stomach bug type things, nausea, vomiting, diarrhea. They're almost always self-limiting, meaning they just get better on their own. And if you're a healthy person who has a healthy immune system, they just get better on their own. But what seems to be happening with these cases, and from what's happening in Great Britain, most of these cases that we've seen so far have been seen in Great Britain, and they've been studying this longer than anybody else so far. And they found in about 3/4 of these cases that there was a connection to this particular adenovirus, and it's causing hepatitis. Now, let me clarify a little bit. Hepatitis can be any inflammation of the liver. We typically see, and what we typically think of with hepatitis are a family of viral hepatitis, hepatitis A, hepatitis B, hepatitis C, that can be foodborne, it can be bloodborne, but these are the classic ones that we typically see. But what we're seeing now isn't one of those. It's another form of liver inflammation.
I don't mean to interrupt you. Isn't there a vaccine that kids typically get against hepatitis, or is that something that comes later?
So yes, hepatitis A and B both have vaccines available that are very, very effective. What we're seeing now is a different virus that's causing an inflammation of the liver. And what's concerning, as I said, is that this is usually a pretty benign virus. So there really isn't an answer yet of why that's happening. I've seen some theories that it could be that the immune systems of these children, after 2 years of wearing masks and really not being exposed to many other people, that their immune systems are waning or flagging and haven't been able to fight off these viruses, but that's not proven.
Okay, Vice President Harris getting Paxlovid, Pfizer's Paxlovid, without having any symptoms. I thought there was something about doctors weren't supposed to treat somebody that's supposed to address symptoms unless they have those symptoms. What is your take on that?
Well, that's true, Bob. And not only just having symptoms, but Paxlovid is usually reserved for people who are at high risk of progression to serious illness and hospitalization. So it's really reserved for people who are in those high risk groups that we're all familiar with, the elderly, the obese, diabetics, you know, the people who are immunocompromised, who have weakened immune systems. So most people really shouldn't be prescribed Paxlovid. As a matter of fact, I get calls from patients all the time that they think it's sort of like Tamiflu for the flu. You know, when people get exposed to the flu or they get the flu, they call me up and say, hey, can I have Tamiflu?
Yeah.
And the answer is usually sure. Paxlovid is not Tamiflu for COVID.
Okay.
I want to make that clear. There are a lot of side effects. There are a lot of potential drug interactions with commonly prescribed drugs that a lot of at-risk people are on. So you have to be pretty careful with it. So no, it's really not approved for the general population.
Yeah, that's interesting. I feel like they're not telling us something. Either she does have symptoms or they shouldn't be treating her. There's something that doesn't ring right, doctor.
Or perhaps she's got a risk factor that we're not aware of. Maybe she is at risk, has some risk factor that we're not aware of that puts her at risk.
They should tell us. So
they should tell us.
Doctor, thank you so much. We appreciate you being with us, sir.
Thanks, Bob. Have a great day.